Well, there's been a lot of talk about the fact that we are peaking when it comes to COVID. And you can see in the New York Times today, that's the headline, is Omicron peaking? Numbers are showing signs of leveling off, but health experts are still urging caution. So that's, of course, a New York Times article. I want to bring in Dr. Stanford, founder of the Black Doctors COVID-19 Consortium, to talk about what's going on here. And would you say the same? Good morning to you, Dr. Stanford.
Hey, good morning. So yes, I think that we did hit a peak immediately after New Year's. Our positivity rates were 45%. I've seen that come down with our rapid testing, now 35, and most recently 25%, which is still, 1 in 4 people with coronavirus disease. I can also tell by the lines that are wrapped around the block and wrapped around the Center for Health Equity when we test that the numbers are trending downward. That being said, for the areas in the country that haven't seen it yet, their peak may be coming.
Okay, well, this is good news, right? I mean, I even heard someone yesterday saying, oh, everything's going to be fine. We're peaking. This is almost over.
Not exactly, because we still, in the United States in general, about 65% of people are fully vaccinated. That means 35% that Omicron is really impacting in terms of the hospitalizations, the deaths, and how sick you are. And so if you're unvaccinated, it recently came out that you're 10 times more likely to contract COVID, you're 17 times more likely to be hospitalized, and you're 20 times more likely to die. That came out from the CDC. So I wouldn't, exhale quite yet. If you've got a friend who hasn't been vaccinated or hasn't gotten their booster after 5 months, I would encourage them, basically because you care about them, to take care of themselves.
Mm-hmm. And when you talk about this too, I just want to have the distinction. We're saying just the Omicron variant, right? We're not saying that the pandemic is peaking, or is it?
So we are talking about the Omicron variant is peaking, and we've seen these surges. We saw it with Alpha, which is what initially was out in our April, May of 2020. Then we saw it with Delta, and now we're seeing it with Omicron. But there's still some Delta cases that are mixed in there, and I don't even know that I would distinguish it. Right now, this pandemic is largely of the unvaccinated and of those who are most vulnerable and don't get maximal protection from a vaccine, or they're too young to get vaccinated. That's who's getting impacted the most. And so this is not the time to say, oh, it's just passing, it's okay, because our hospitals are being pushed to the brink right now with so many who are being hospitalized.
Yeah, that's an important point. So what do you say then to the people? Because a lot of the talk about Omicron has been, well, even though it's more contagious, it is milder. And so some folks are saying, in order to we can get to that peak and just get it over with, they're saying, hey, I don't mind if I get it. Let me just get it so I can get it over with and move on. What do you have to say to those people who feel like, hey, I don't mind getting it at this point?
Well, first of all, it doesn't feel good to be sick. I mean, you can roll the dice if you want and see if you're going to be the one who gets really sick or not. But folks are sick for a while. Then after you're sick, you don't know if you're going to be a long hauler. When you need to get to the hospital, because the hospital and the supplies are really short, you don't know if you're going to be waiting in an ER or a hallway for days before you get the treatment you need. And even though you may not get sick, it's a public health crisis. It's a pandemic. The person you may infect may be sicker, and it could be someone you love. And so, granted, we've got these pills that are coming out, and we've got monoclonal antibodies and all of that, but it's not universally available. Everyone won't have access to it. So I think you're really playing a game of Russian roulette to do that and say, it's not that bad, and if I get it, I get it, because you don't know what your course may be.
Yeah, it will be a gamble, that's for sure. So who's getting hit the hardest right now? We're hearing that when it comes to SEPTA workers, they're dealing with a lot.
Oh, our SEPTA workers, who have been really keeping our city going. And I commend Leslie Richards. It's not been easy. A lot of our SEPTA workers are who we lost in the beginning because they were interfacing with the public on our subways and buses and trains. And that's why now I heard you report some of the lines are short. They've got staff shortages because they're continually exposed. We still need to get those vaccination rates up. We still need more testing so that when one person tests positive, you can do the contact tracing and diminish the transmission. But yeah, they're being impacted. Our students, we know that only 8% of African Americans, 12% of Latinx, and 24% of white children have been vaccinated that are eligible. We've got to get those rates up. That's why our schools are closing. Our kids are having to go virtual again. The hospitals are really full and the ICUs with children. And so they're still are vulnerable. So that's what I'm seeing.
Okay. I know you're going to be putting on some town halls. Tell us about the town hall that's coming up.
So we've got a town hall tonight, 7 p.m. I encourage you guys, you can go to the School District of Philadelphia, the Teachers Principals Union, certainly our website for the link. But we are basically unveiling, vaccinating our students, staff, and support folks in the school for the next 30 days. We will be at a school every week to give vaccinations. And we hope that that will decrease, some of the school closings when our kids are ultimately protected. This is with support from OEM, FEMA, the Department of Health, and the School District of Philadelphia, because honestly, not one of us can do this. It takes a collaborative approach of everyone being supportive to protect our kids. And that's what's going to start on Martin Luther King Day at the Center for Health Equity, offering, of course, free vaccines. But the information session tonight, 7 p.m.
Okay. And that's going to be on Zoom, correct?
That is correct. That is correct. And there's also information that you could call in if, for example, you don't have video capacity.
Okay. Well, thank you, Dr. Ayla Stanford. You continue to do great work in our community because, like you mentioned, it's not over yet.
It's not. It's great to see you.
It's great to see you too. Good morning.
Good morning.
Okay, we're going to take a break.